Welcome to Hornbill TV's Beyond Headlines with ELDELY. Amila dangor kokai khan poila Dimapur niche de thakishe. Tai khan laga gor osor de ekta chokra aro ama ekla thakishe. Mota bi nai, khandan bi nai aro tai khan olop dukhiya gor thakishe nagi. Itu laga ama to ekdam omor bishi hoise ekdam buri thakishe. Koi hisab ama bra olop sholop pata shata khan bigri urina tai khan ghor do cholai thakishe. Itu upor itu ekdam buri ama bra ghor laga kam sob sai thakishe. Now kau la takot bi harai jai ase koi hisab kitia to tai khan do bhat sat bi nubunai na khai na kwa hunishe. Kitia ba to tai khan pani bi kunba bra bi bhuraule nai kile mane tai bra bi na parya hoi jai sha aru itu bacha do koi hisab itu bacha to tai hudai mobile shobail de thai goise. Mobile phone noile sati kani noile bi gorde na thage goise. Aru buri ama ekla mudut diule kun bi nai. Moila kokai aro nobo khan tai khan itu la ama gor osori thagi thaishi to Dimapur niche de poila. Now for those who might be wondering what Nobu means, Nobu is sister-in-law in Naga Mizora home. Bindu means brother-in-law. To mula kokai aro Nobu pra kitiaba to tai kan batsat bunai na pothai di wei to ama kan itula chokra khan la gorde. Kitiaba to tai kan pani bi bhurai dibo. Aro kitiaba to tai kan jaina itula mala gorde gor to safai kuri di. Ena kuri na ishe kwa hisab. Now amila Nobu to taito lothala maiki ase. Apni kan sob jane taito ekdam mon bi shona jandi nishna ase ole mukto olop Raja Mircha side fini jaise toy. So my sister-in-law mula Nobu bra itu chokra ge ekdam gali di thaishe. Itte de gor sapa kori dibe amage. Itte bhatsat amage bunai dibi. Nole te mihin kori dibo. So that was how my sister-in-law used to scold that kid because his mother was very old but he was not really helping at home. So ina kuri na aishe. But we are not talking about juvenile irresponsibility here. We aren't talking about wayward children or dysfunctional families. I believe that a son loved his mom. Why not? We don't know their story. But my point is this: willful negligence, abandonment, and even abuse that is perpetrated on elderly parents and relatives. Not caring for them, abandoning them, abusing them mentally and even physically. That's the point I want to make. Data for Nagaland would have offered us clarity about this phenomenon. Apparently, though, this uncomfortable reality among Naga families is more common than we have the shame to admit. Anecdotal and observed circumstances seem to suggest more elderly parents in Nagaland are being left to their own devices. Kahar de ekla noy, bosti de bi ase. Bosti de jai saile, bura buri ama papa chari dia laga bishi apni sabo ar hunibo. Salsa lagi de moi newspaper ekta lo de kam kuriya dem de moila editor aro moi kan mon train sang fini moi kan birai jaise. To ekta kinar bosti de ekta bura ekta iman chutu ekta thaishe ekta morom ekta kwa hisab tai do bosti la matha ekta ase guishi tu tai la chuka do gumala jaga bi ase bhat sat khala jaga bi ase aru itu chuka do murgi la gor bi ase gahori la gor bi thakishi tu moi kan ja dam de ekdam bigari aru dukte tai thakishi moila bhavna de Nagaland de bacha aro khandan bara bura buri ama baba chari dia noile bi no loi lo nasai lo khan bishya se kahar de bi thagile do bosti de phorta ho 2021 de report ekta koise India de bura buri sati na thaga khandan na thaga khan aro ekla thagia to Nagaland de sob se Northeast the highest as you was. Nagaland or Tamil Nadu he bishya se kuisha. That's about 5.7% of the country's senior citizens aged 60 years and above. They live on their own without the support of family or friends. Approximately 130,000 in Nagaland. Buraburi kun ekla bohe ki bimari, gaw mongso bimari, hardi aro bhavna bimari, mansik laga bimari, ki bimari lagi jawle ekdam asani aro ekdam bishi ase na ko ase report khan brabi. Nagaland ekla thagia buraburi to 10.9% nishna ko ase tu akbar khan bra ko do. Nagaland Northeast the highest quasi, or India the second. Nagaland has the second highest number of elderly people living alone after Tamil Nadu. Now the isolation and loneliness in senior people go hand in hand with old age, and these conditions are becoming more and more common. Papa amake chari dia buraburi kan morom na korea nasai na chari dia itula kotha do ekdam doha ase dei. Moi khan itu sorom do lukai thakia karne buraburi khan la duk suk to aro bishi ucha hua ase. Kotha do moi khan na lukai gina itu khan la sorom kotha khan bahar di ulai kotha shur hoise gole bola bhabna de to aste ki ba ekta rasta do khulai jabo na ki ulawo na ki na bi bhabi ase. Sorkari fine barabi ahibole paribo, samaj fine barabi ahibole paribo. Moi khan nijor ekjon para hoile bi ekta bhavna ulai na rasta bi ulawo na ki na bhabi ase holi moi khan bra itula sorom deini dabai dia garni buraburi khan bra ki monduk jase ki homoy de ahiasi tukan pahar de kun bi ulai na kobole na pare do na jane do to moi khan itu kotha bole ase ko nishna itula kotha do ekdam doha ase itu karni itya to ki rasta kina laga homoy moi khan eklam takia buraburi ama baba khan karni bunai dibo itu ekbar moi khan kotha kori sawo. I have 3 best friends. 2 of them are French and the other is British. All of them are businessmen with enterprises in Europe and Asia. One of them is settled temporarily in India. Now their work demands a lot of traveling across the world, meaning they often have to leave their parents at home for long periods of time, my friends. Now their parents in Paris, 2 of them in Paris, are well in their 90s. They're quite elderly. The age of my other buddy's parents in London could be in the similar range. But this is the best part. Government-run and private-run geriatric services and homemaker services are widespread, and they're common in France and the United Kingdom. In fact, it's considered basic welfare facility there, like we consider electricity supply basic facility in India. Very common. Even better, volunteers, youth, students, fresh graduates, social work interns, they assist the elderly who live alone. Tai kan sob shadi hui she mula sati kan dui jundo French manu ase aro ek jundo British ase. Tai kan laga didi bohini bi ase oli alag jaga de sob bohi edu karni baba ma kan ke chhari na tai kan dur tai kan la business karni kam karni ulaule hoi jai hole bi kotha jitu ase tai khan la baba ma khan dadi dada khan karni tai khan jinta iman nai baba ama khan sob gorde rakhi gina tai khan nijor la sapna to khetawole pari ase kile mane tai khan la jaga de bura buri ama baba ekla thakia khan saidia services bishiaze in France and the United Kingdom. Kunba do sorgari la services, kunba do so much laga services. Aro kunba do nijor laga monbra ulai gina chogra chugri kan students kan bra nijor laga jaga debra jama bunaina bura buri kan mudud di birai ahiase. Tai kan hudai na ase. So whenever my friends are away, the government's welfare services and the local geriatric services come in to do everything for them. Amni bisas nati wo. Would you believe that they have government-funded homemaker services too? Clean the house, they'll get groceries for you, they can get medications for you, they will take you to the hospitals for regular checkups, or they'll just drive you around in case you have places to go in the town and there's nobody to drive you or help you. There are also local volunteer groups that help senior citizens without payment. My friends tell me they don't have to worry about their parents, at least in the context of taking care of their immediate material needs. France or United Kingdom they do sorkari lagabi ase so much lagabi buraburi ekla chari dia laga pawa ma khan duk suk sai dia laga jama bishi ase to geriatric services or homemaker services to kya si to olop koi sabo the way aro gao bia homoi de apni ke sai dia laga kam to geriatric services koi ena mate itu to all of doctor aro nurse laga kam khan nishna ase holibe ekido no hoy now geriatric services te kam guria manu khan bara hafta holibe bishi bag no holibe din tate bishi hoy din hisab de gor de ahina ekta ekjun ke tawai sai diwo hospital de loi jai diwo tai kan gao bimar kya ase amni lo de ahina itu bi sai diwo aro ko ini gao kina ase gor tai khan jaina din hisab te ama baba khan saina jai pura buri khan bacha ama khandan osorde na thakya khan no helebi e tai khan kiman lage itu do din de helebi hafte helebi tai khan hudai sarkari bra itu geriatric services koina itu kan kam koria manu khorde pothai tai khan gor de kina ase aro igu lage na nai apni tai khan sob ahigina sob kori diwo aro hudiwo itu ko ase tai khan do bishi bag gao bia ro dawai laga kotha hi tadehi madad kore geriatric services to itu do geriatric services ko aro France or Germany Europe sob jaga de ase homemaker services itu be ekta service ase itu do bura buri khan bawa ma khan lo de mudut korea la services itu do sarkari labi ase somaj labi ase aro volunteer group koina tai khan bi ase to homemaker services to kya ase kole gor laga kam nijor laga kam sam sob tai khan sai diwo itu kan do homemaker services ko itu do moi khan ki koi moi khan la kotha ra kancha mini ase na itu kan la nishna noile bi domestic workers koina ase na domestic help koina ase na itu kan nishna holi no hoi itu kan ola professional se moi khan itu pichidaro moi khan kotha koriwo itu homemaker services are itu do sob sorgari nohoi holibi eklai nohoi holibi so much rabi tai khan sob sai gina itu tai na so much te sob birai jai gina sai na jai this is slightly similar but not the same as domestic help or domestic work that we have in say India. Homemaker services are regulated and are a trained and a more professional service. अपने एकला नहले भी गाँव बिया से कोइले homemaker services सरकारी बरा पठाओ गुनबा दो geriatric services एकला ही दे और गुनबा दो homemaker services एकला ही दे और गुनबा दो एक बार बरा geriatric services और homemaker services दुईटा भी एकेलो दे service तो बुरा बुरी अमा खान दे अपनी बाहर दे बिराई जाई साइले दो यूनाइटेड किंगडम होवे यूनाइटेड स्टेट्स होवे जापान होवे सिंगापुर Canada sob de tai khan itu geriatric services ko ina thaiwo aro homemaker services ko ina bi thaiwo hoi kakos hisab de do India bi ina services olop milya nishna olop ase welfare services holi bi itu laga kotha do olop piche de moi khan kori sabo as stated earlier, there is a need for our government and welfare NGOs to start thinking about our elderly, both those who have been abandoned and those who live alone without their children, relatives, or even friends. Now, does India have geriatric services? Yes, we do. On paper, at least. Kakos ne do India bi sarkari la geriatric services ase koina dia se taikan. Monduk do India de bura buri aro baja khandan bara nasa chari dia itu bawa ama khan la services to bishi bhag do komti noile bi no ponche sorgari bra thik se itu kam ekdam nogore sob jaga de ini jaga de ase bosti no hoile bi kahar de moi khan sob dikhi na ya se itu gando you know how development looks like in places like Nagaland. अपनी जीवन दे एक बार भी किताबा भी नागालैंड ला डॉक्टर नर्स हेल्थ वर्कर्स रा गोर अपनी ला गोर दे आई कि ना अजी तो दवाई खाइना खाना है पापा यू नो अजी तो हॉस्पिटल ले जावा मा कोई ना एक बार भी दिखना दिखा नहीं. On paper, the government of India and by extension at the regional level, the Nagaland government has geriatric services. Sadly, they are essentially in the form of institutional programs, schemes and initiatives instead of direct on-the-spot caregiving services. And that's another big problem here. Availing these services involve a mind-boggling area of lengthy, complicated and extremely stressful documentation, identification, mobility, verification paperwork and bureaucratic processes. These programs are almost self-defeating because they make senior citizens go through difficult procedures, distance and documentation to avail services that were actually meant to make things easier for them. Have you ever had a community health worker in your village show up every day on your grandparents' door to check their blood pressure, instead of them walking a kilometer to the nearest clinic or hospital? Have you ever seen that? Kagos Rado India bhi ase to one geriatric services or homemaker services going now. National Program for Healthcare of the Elderly and PHCE. Holebi to Bishi Bagor Hospital Gao Sao Salaga Center Building Buna Fini Saitia Zituando Gor Hat to Hat Nijor Laga Diki Paikina Taikan visit करना जाखन लगा नले हुदाई साइ थागला नो it developmental program nishna as a. Now this program implemented here and there through the Ministry of Health and Family Welfare involves setting up regional centers and national centers to provide specialized care including OPD, physiotherapy and laboratory service, not for direct intervention. Scheme our program itu thagiagan naam de parato bishase India debi kothado moi khan ki lage ase itu du nai community based care koina ekta ase itu du gor laga kam ase holibi itu bi itia tak dikhina moi khan ektam pa nai itia tak to kunba jade bosti de no kunba bra kitiaba toini birai na jai thagi bolebi lage holibi bishap bag to moyan kaha de aro bosti khan de tu ando dikhi sanai sob jaga de no hoy aro itu bi hudala bi no hoy itu to olop diktar ka ise bosti mani khan korni to moi khan la bura buri khan lagia do ek moina de noile 4 moina 1 saal 2 saal bichire laga lagia no hoy tai khan do mudud lagia do din hisab ra noile bi at least ek hafta de ek bar hisab la mudud lagia hi ase tai khan do aro ekta kotha Nagaland nishna de services thagilebi kam korea manu khan mon di kena kam kore asana nai itu bi ekta kotha ase. You know everything about Nagaland, you know how things are like. Apni hawa jawa sob jane ase Nagaland de ki hua ase kam jaina na jai itu bi ase. You know about shortage of workers, teachers, doctors everywhere. To services to iman bishya je bura buri karni hole bi taihan korea sina no korea se itu itia to nokobo doctor khan tak bi bosti de posting na jaile taikhan laga niche mati de kam korea manu to taikhan kam de jabule mon thagibo na thagibo itu bi na jane ja bi na jai asna na jai bi itu bi na jane moi khan age de moi khan hudia nishina अपनी जीवन दे कहार दे होले भी बस्ती दे होले भी किदाबा भी नागालैंड ला डॉक्टर नर्स हेल्थ वर्कर्स बरा अपनी ला घर दे आई ना अमा अजी तो दवाई खाओ ना खाओ अजी तो ब्लड प्रेशर साइड हो अजी तो अपनी ला खासी की ना जे हॉस्पिटल अजी तो ले जाओ बोले आई जीते. Have you ever seen anything like that before in your life? Homemaker services. In India, the concept of homemaker services is still rudimentary, even unknown. A few enterprising companies do offer paid services though here and there, but it's still very rare. I'm told that Assam and Meghalaya have already started ground level geriatric services and homemaker services, but it's still a tiny drop in an ocean considering the growing population of the elderly and the number of lonely parents, abandoned parents and neglected parents. Again, Because there are only far and few organized homemaker services, these kinds of services will be out of the reach of people who actually need it. Another reason why organized, regulated homemaker services in India are practically a new concept is this. Indians have traditionally kept unskilled individuals as helpers or domestic help. But that's only for those who have the money to afford it. And then there's the controversy and concerns about abuse of domestic helpers. Nagaland Devi itu kothau lai thage malik bra kam guria bacha ke mari dishe pitai dishe goi itu mari she itu pitai dishe itu la kothai huni thage aro itu karni itia to ghor de kam guria manu napa hoishi poila nishina aro baba ma khan bra bi itu bacha gan ge itu an la duk dikhi na tai kan bi manu la ghor de pothawle mon jana thaga hoise aro tai kan kostra dusra kotha bi ulai thage tangkha biya ase koi ole mar tho khai thage koi kam bi na jane kunba complaints to bajala baba amma khan tai khan bra kunba to itu purai dibi koi ole wi ki misha wo moi kan manu la ghor bacha gan ge puriule dibule pothaile to kile kam guriule rakhiu na enala kotha bi ulai thage so there's a lot of controversy there ari na la dukhan controversy kan ulai thage holi bura buri khan ko kunbi sabole nai holi bi lagya do lagya ase there is one solution. It might not be the perfect solution, but is the best place to serve for our people. The government of Nagaland, that is the family, social welfare, women and child development, and medical and health departments, they can work on a multi-segment program that combines both geriatric and homemaker services, both paid and welfare-based services. This may be created on a model of communitization or on a community convergence levels. This program should be regulated by the government and administered by the district and municipal authorities beside the council level establishments. This may cater to the needs of the abandoned elderly individuals or those living alone. Now, the implementation should be at the house-to-house and individual-to-individual level, based on who is eligible and based on the requirements. The services may come with charges for individuals in the high income category. That's my suggestion. 2, charges for those in the middle income and low income categories may be subsidized. Third suggestion, those who are in the zero income or insolvent category may be given the full services for free. Moi khan la ekla thagya bura buri khan karne modut dibole sarkari bra itu upai ekta ase Nagaland de health, family welfare, social welfare, medical department milaina program policy ekta bunaile rasta aste bra khuli jabo nagi na bhabi ase itu du sarkari ekla bra no hobo public private mode bi hobo pare itu. We need government regulated administration implemented and institution trained home caregivers in Nagaland. The scope of this service and the potential revenue it can generate for the government may go beyond those who can afford it. It may be used even by regular families who would appreciate an extra help with a ready service like that. Nagaland de do ami khan la jawan aro komulya khan nokri pawole ekdam tan aro bitor kinar de thagya jawan khan do kam pawole ekdam upai nai. Home care services para nogri rasta bhi khuli ule pare. COVID bimari hua piche de enala kam karne kahar de bosti de demand ekdam lage aro koina uthya se koina media khan be na koi taise. UK de do home keeping aro home care services kam guria manu 1 lakh upor de ase UK de do specifically 1.47 lakh professionals. France they do 6 lakh upor de ase. India do kiman ase tia tak to data nai moi kan numbers kan na jane holi bi demand hisab te professional home care or professional home keeping services bishi lagi ase koi charo uthi thage na koi shem hoi India ro Nagaland sob de ghor de kam guria manu rakhe domestic helpers ko ina holi bi ko nishina ulta kotha noha kam bishi ulai thage. So if we have a government-regulated home care and homekeeping services that combine the skills of trained healthcare and homekeeping professionals, there shall be an actual industry there. That's what I suppose. This has the potential to create employment opportunities, increase welfare outreach for the government, and a better quality of life for our elderly citizens, especially those living alone or have been abandoned. Come on, nobody said it's going to be easy. Nobody is saying we wouldn't need substantial resource investment in there. But hey, let's be honest, if we can budget millions for Nagaland departments that have practically no measurable work or results, if we can give lakhs and lakhs in salary to employees that don't even attend office, why not try putting it into a new project that can actually help our elderly and senior citizens? A government-regulated home care and homekeeping services will give rise to professional, trained individuals. This has the potential to generate revenue for the government, yes. This again will create a separate employment pool of opportunities for Naga youths. Now this has the potential to reduce abuse of domestic workers too, because there will be government administration and oversight taking care of this industry by legislation. Again, this may remove the negative image of domestic workers, and it might give them a respectable professional image and dignity. If the government legislates such a system, regulation will mean there will be clear-cut salary and benefits packages too. There will be no abuse, or at least there shall be drastic reduction. Why? Because a legal framework for workers will be in place under single labor laws to protect them. Further, economically challenged families can send their youth to receive training to work as domestic caregivers, to work in a position that is dignified, government recognized, and of course professional. And everyone, especially our elderly citizens, especially those abandoned or living alone, may potentially have a better quality, more dignified life in their old age. This is a complex topic that has layers and layers of social, cultural, political, filial, welfare, and administrative complexities. Our hope is that the government of Nagaland and our community would work together on a legislative and political apparatus for the elderly and abandoned parents. Another hope is that this topic would provoke a conversation about the value systems and the modern cultural changes that Nagaland is going through. What do you think? Let us know in the comments. Thank you for watching Horrible TV. I'm ELDELY. See you next time.